Good morning, everyone, and welcome to our coverage on the highly debated topic of abortion. So, what is abortion? Abortion refers to the termination of a pregnancy before the fetus is viable, able to survive outside the womb. This can occur naturally, which is called a miscarriage, or intentionally through medical procedures. There are various methods of abortion, including surgical procedures and medication induced abortions. The decision to have an abortion is often a complex and personal one that involves medical, ethical, and emotional considerations. The laws regarding abortion vary by country and region.
So thank you for that definition, Miss Jalen. So this is now the clinical manifestation of abortion. What is the treated abortion? If we say treated abortion, it is used when there is vaginal bleeding prior to 20 weeks gestation. This may be accompanied by abdominal aching or cramping, and upon vaginal examination, the cervix is found undilated. When there is treated abortion, this is mainly cause of number of factors, and this including hormonal dysregulations or vaginal infections. Second one is the inevitable abortion. So in inevitable abortion, there is both bleeding and lower abdominal cramping, accompanied by some degree of cervical dilations. Bleeding may range from minimal to severe, even the life-threatening. Inevitable miscarriage should be threatened with strategies to prevent miscarriage. Next is the incomplete abortions. So in incomplete abortion involve vaginal bleeding, cramping or contractions, cervical dilations, and complete passage of product of conceptions. A woman experiencing incomplete abortion frequently describe passage of clot of piece of tissue and report vaginal bleeding. The cramping may be rhythmic or labor-like, although less intense than a full-term labor. So if there is incomplete abortion, there is also a complete abortion. So with complete abortion, all of the uterine content of pregnancy are expelled. So after which cramping and bleeding subside, the cervix return to a undilated state, and the uterus begins to invulate. Other symptoms of pregnancy disappears, and pregnancy test will yield or negative result. Now next is the misabortion. So misabortion refers to a fetus that had dead but retained in the uterus, often with no signs or ensuring miscarriage. This condition may persist for several weeks before miscarriage spontaneously commences. And for the last one, which is the habitual or recurrent abortion. So habitual or recurrent abortion refers to history of repeated miscarriage defined as a 3 or more successful pregnant losses, and habitual miscarriage suggests that need to medical evaluation of couple and ongoing care for what may be chronic problems. Example for this is the hormonal dysregulation, infection, etc.
Next is the assessment and diagnostic findings. In assessment, we have to assess vaginal spotting. Assess if there is vaginal bleeding during pregnancy. Bleeding is due to implantation abnormalities. Second is lower abdominal cramps or uterine cramping. Next is fever and body malaise. And lastly, possible signs of infection. So next is the diagnostic findings. In diagnostic findings, we have medical history, physical examination and laboratory examinations, ultrasonography, and serum HCG testing. In medical history, clinically stable patients need complete medical evaluation with both individual and family histories to assess for medical comorbidities. Patients with conditions such as bleeding disorders, large uterine fibroids, or suspected molar pregnancy, or who are on anticoagulation medication may have a higher risk for bleeding and other complications with expectant, surgical, or medication management of pregnancy loss. Second is the physical examination and laboratory examinations. Patients who present with confirmed or suspected pregnancy loss undergo speculum and bimanual evaluations in addition to general assessment. Handheld tone Doppler evaluation may be performed for pregnancies of 12 weeks gestation or greater. Next is ultrasonography. It is the preferred modality to verify the presence of a viable intrauterine gestation. And lastly, serum B HCG testing. It can be helpful in making a highly certain diagnosis.
First, we have the threatened abortion. So doctors usually recommend conservative with bed rest and reassurance until bleeding stops for this kind of condition. Sexual intercourse is also avoided, and in 95% of cases, presence of fetal cardiac activity predicts good outcome, so follow-up with ultrasound is advisable. Hormone therapy with 400 grams natural progesterone in 2 divided doses orally or vaginally in empirical basis. So the last one is the anti-D if mother is Rh negative and pregnancy is beyond 12 weeks. So anti-D injection will destroy any Rhd positive blood cells that may have crossed over into the mother's bloodstream. So during the delivery. So we have the inevitable abortion. In the first picture, the body parts are grasped at random with a long tooth clamp. So the next step would be the body parts are pulled from the fetal body out of the vaginal canal. And then next would be the remaining body parts are grasped and pulled out. For the next step, the head is grasped and crushed in order to remove it from the vaginal canal. And the last step would be the placenta, and remaining contents are being suctioned from the uterus. So for the next one, we have the incomplete abortion. So under this, the doctors usually recommend resuscitation if the patient is in shock and evacuation by suction evacuation. So if the OS is closed, PGE1 tablets are kept in vagina for ripening the cervix. So PGE1 tablets are a smooth muscle relaxant and vasodilator. Doctors also recommend prophylactic antibodies to avoid infection and of course anti-D to destroy any Rhd positive blood cells that may have crossed over into the mother's bloodstream during the delivery. Then we have the complete abortion. So just like incomplete, conservative treatment is also advised, but anti-D is not indicated if pregnancy is less than 12 weeks and there was no operative intervention. Next is we have the missed abortion. So for the medical management of this one, uterus evacuated as soon as possible. So a donor should be kept ready. So if the size is less than 12 weeks of gestation, PGE1 tablets are kept in vagina, which results in spontaneous expulsion without the need of surgical intervention. So if more than 12 weeks, early PGE1 tablets are also used vaginally, which will result in spontaneous expulsion or extra amniotic ethacridine acetate. So under this, doctors also use anti-D and antibiotics. And then we have the last one, which is the septic abortion. So if this happens, police notification if criminal abortion is suspected. So the medical management for the mild cases is broad spectrum antibiotics are started and uterus evacuated. So for severe cases, maintenance of perfusion and ventilation is being indicated. So under the medical management of septic abortion, doctors also recommend IV infusion and CVP line insertion. So we have here the illustration of CVP line inserted in a human body. So this is where a CVP line is being inserted. So under the medical management of septic abortion also, we have the blood transfusion, and then oxygen is also given by nasal catheter. Antibiotics are commenced after taking a high vaginal swab. And then doctors also prescribe ampicillin, gentamicin, and then metronidazole, or third generation cephalosporin like cefotaxime or cefuroxime with metronidazole or clindamycin. And then the last medical management would be the evacuation of uterus after infection is controlled. That's all. Thank you.
So next is the pharmacologic therapy. So first is the mifepristone and misoprostol. Mifepristone is a medication that blocks the hormone progesterone, which is necessary for maintaining pregnancy. And misoprostol. Methotrexate is a medication used to treat certain cancers and autoimmune diseases. It works by stopping the growth of rapidly dividing cells, including the cells of the placenta. So the third one is the misoprostol alone. Misoprostol can be used alone to induce abortion. This is a less effective method than using mifepristone and misoprostol together, with success rates ranging from 70 to 90%. It can be used up to 12 weeks of pregnancy. Next is the ibuprofen or acetaminophen. It is to help with cramps or bleeding. Ibuprofen was found to be statistically significantly more effective for pain reliever after medical abortion compared with paracetamol. Last one is the antibiotics. It is used to prevent infections.
Pre-procedure education and counseling. Nurses provide patients with information about the abortion procedure, possible risks and complications, and what to expect during the recovery process. Counseling may also be provided to help patients cope with the emotional aspects of the decision to have an abortion. So, this pre-procedure education and counseling are important components of nursing management of abortion because nurses provide patients with information about the different types of abortion procedures, their benefits and risks, and what to expect during and after the procedure. They also provide counseling to help patients cope with the emotional and psychological aspects of the decision to have an abortion. Next is the preparation of procedure. This preparation of the procedure, nurses may assist with preparing patients for the abortion procedure, which may involve administering medication or providing instructions on how to prepare for a surgical procedure. So, nurses also play a vital role in preparing patients for the abortion procedure, depending on the type of abortion. This may involve administering medication or providing instructions on how to prepare the surgical procedure. Nurses may also answer any questions or concerns that patients may have about the procedure. Next is support during the procedure. Nurses may provide emotional support to patients during the abortion procedure, including providing reassurance, holding their hand, and answering questions. So, during the abortion procedure, nurses provide emotional support to patients. This may involve holding their hand, providing reassurance, and ensuring their comfort. They also monitor the patient's vital signs and provide medication as needed. And lastly, the post-procedure care. After the abortion procedure, nurses may monitor patients for any signs of complications and provide pain management as needed. They may also provide education and support for the patient's emotional and physical recovery. So, this post-procedure care is an essential component of nursing management of abortion because nurses monitor patients for any signs of complications such as bleeding, infection, or pain, and provide pain management and other interventions as needed. They also provide education on self-care, including how to manage pain, when to seek medical attention, and when to resume normal activities. We are the Group 2, and thank you for joining us today.